So it's the week
Okay.
3 reflection.
Yeah, it's recording now. Um,
Okay.
so I mean, last week I thought it went really well.
I would agree, definitely.
Um, the only thing I put was um, the week before. I said, it's really too early for transference or countertransference. Um, and even this, it was the first session. I'm like, yep, had some countertransference there. Hit way around, and I loved that we're supposed to be this 28-year-old, and I loved how you were like telling your story and it became you, because I thought, oh good, this can be helpful.
Yeah, absolutely. I think there can be that transference and countertransference in any situation,
Yeah.
just depending on your own emotional or their own emotional needs.
Yeah, and I mean, from my memory, transference is like you were talking about before, when they're kind of
Yes.
using you as a symbol, and countertransference is where you're kind of really seeing yourself in them. And I know I read somewhere that a lot of the work happens in transference, which makes sense because they're practicing out. So if they have issues, say, with a parent, and they start to look at you as that parent, that's wonderful because they can practice. But I can see the danger too, because you don't want your patient to call you mom.
Right. What I get a lot is I'll get a lot of men who are, because I also do child safety cases. So the
Oh,
family will be involved in a child safety case where something has happened, and, Child Protective Services have stepped in and kind of removed the children, and they have to do things to get reunified. I had one this morning and did a psych eval on this gentleman, and he is separated. It's him and the long-term girlfriend having a lot of issues, a lot of dysfunction, yelling and arguing, and
right.
he has a lot of PTSD related to a lot of losses in his life, so very, shifting, kind of fluid like childhood. So he's telling me all these things, and how things are difficult with the girlfriend, and he feels that he needs to have a family, so he's very attached to his children. He has many children by different women, and the relationship is everything to him. So what had set off this situation is that they had a no contact order, and they're young, and the mother called him and was like, you need to come over here, I have to go to work, I need you to watch the kids. And he's like, but there's a no contact order.
Yeah.
So she drove to where he was, picked him up, brought him over, and said she had to go to work. So he was like, well, I guess I have to do this for the kids. Found out that
Mm.
she was out partying, calls her up, and then she says, I don't love you anymore. I want you out of my life. And
Oh
so
my
that
gosh.
triggered him to feel abandoned. And
Yeah.
he felt, that he was going to lose his family because it was the only family he had. So he's telling me all these things, but so now the police are involved, and he had a gun, and he threatened to hurt himself in front of the children or hurt the children. He barricaded himself in the house because he was like, if I can't have my kids, no one can, kind of thing.
Right.
Well, the whole time he was telling me this, I started to realize that he was transferring onto like me as his wife. So he was
Oh.
flirting, and he was, things like very inappropriate things, and so I would have to redirect him and kind of bring him about. And at one point I had to say, I think perhaps you need to focus more on, getting the children back, and I think this needs to be your piece right now, and you need to get into therapy to work on your relationship issues and your attachment issues, because of that. And so he agreed to that. He was like, you're right, I jump into these relationships too fast. I was just like,
Oh
it's not going to be with me.
my. Well, I mean, that happens a lot with when you're seeing adults, because sometimes they don't quite get this is not a friend. And I've actually had to tell that when I was working in an abused women's shelter, and I would see outpatient, and the one, she'd be like, "Oh, we should go out to lunch sometimes. Oh, you're so great." And I had to break it to her. I'm not this kind of friend. If we went out to lunch, I would be telling you all my crap. And she's like, you have issues too? And I'm like, this is about you, not me.
Yeah. I think the ALS work that I do too, I have some patients that have like transference, and I have some of that counter transference when it comes to
Yeah.
elderly people because it reminds me of my grandparents. And so I have to be very mindful of that as well, that emotional aspect, and that isn't my grandma, and that is just somebody else's, and that there are a million people in nursing homes that don't have family. So that's something else to be mindful. But they all want to like buy you gifts and hold your hand and talk to you about all their, things that are going on and tell you to come visit. And you still have to say, well, no, I'm gonna, this is my follow-up schedule, and this is when I come, and this is for how long I can give to you.
Yeah.
Can't make any special visits. So that's yeah, it's definitely, people, especially I think in this business, because we're dealing with emotions. Yeah, we're
Yeah.
dealing with feelings, attachment, that kind of stuff.
I had a lot of when I'd see kids, a lot of that would come up and it would be like, okay, this is a child. Like at the end of the session, the parent would say, well, now give Miss Melanie a hug. And they always say, don't touch your clients. And I'm like, I am not going to be the person who says,
Yeah.
your mom is saying to give me a hug. I know how to give a hug. And I'm thinking it's important for them to know that not every touch is sexual, that it can be, because I thought, well, I'm kind of filling in your grandma mode here. Or they would want to give you a gift. And it's like, you can't not take a gift. So I would just like everything would be a gift for the agency.
Yes, I agree on that one, especially in the holidays when people bring in stuff. We would just say, oh, we're going to share it in the break room. Thank you so much for, thank
Right.
you. And it's very sweet of you. Or if it's more of an individualized gift, I just say, I'm going to place it where everyone can see it in the hallway. And that way it can cheer everyone up. That is a tough one. I couldn't imagine having the kids. I think too, though, it's, like you said, with the mom telling the child to give a hug, I think it's important to be like, only if you want to kind of type.
Well, that's the thing is, the parent would say, well, do you want to give do you want to give Miss Melanie a hug? Yeah. Okay, then Miss Melanie's going to give you a hug,
Right, right. I mean,
you
I have
know?
patients that hug me, they side hug you, and you don't realize it's coming, and they just like, woof.
I always thought that was the weirdest thing. When I worked in RTCs, it was like, well, give a side hug. And I'm like, it's like when the fancy actresses kiss the air beside the other person. And I'm like, what are you doing? Kissing the air you breathe? That doesn't even make sense. It's not even a thing. So yes, but you're right. I mean, if they're in charge, and I think it can be a very learning thing, is like, look, here is somebody who likes you, who is trying to help, and work with you, and they're not going to take advantage of that, you know. Although when I saw adolescent boys, I had one kid and I dropped something and I went to pick it up and he was sitting beside me. And I realized he thought I was going to kiss him or something because he kind of looked, and I just looked at him and I said, what are you doing? And he's like, oh, I don't know. I said, well, that's okay. I said, I'm just picking up this pencil. But
Oh, he's just reading the cues. I'm sorry, give me just a second. Hey, 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 I'm recording. Do you want her to see you? Okay, then please be quiet. Go in your room. Go in your go in your room. Please go in your room. Take it with you and go in your room. They're too close in age. They fight. Sorry.
I thought for a minute someone was crying, and I was like,
Well, they were fighting. Yeah. My son comes flying out of he's 9. He comes flying out and arguing. He just got out of the bath, so I didn't want you to see it.
no, we don't need to see that. The best supervisor I ever had, clinical supervisor, when we would talk about things with kids, she'd go, they don't die. They
Yeah,
don't die.
that's
You
true.
know, they go to bed, they won't eat what you make for dinner. You send them to bed without dinner, they don't die. They're fine. Don't worry about it.
They are. Yeah, I think it's definitely a different population. So I've never worked with children other than working at the WIC program, and that was kind of more of their parents, a little bit of the children. I've
Yeah.
never actually had to treat children as patients, and even in my rotations, I was like, oh, am
It
I
can
older enough?
it can be extremely boring
Really?
when they're doing play therapy.
Oh,
It can be extremely boring because I would never like 9 times out of 10, the first or second session, they would invite me into their play, and then I would let them direct it. But sometimes they would just be playing on their own, and I'm just sitting there watching them thinking, "Okay, well, this is interesting. I have no idea why they're doing that, but I'm gonna try to remember that. Okay." But as you're sitting there, as I did in one session, watch this little boy take every single doll, which I didn't realize we had 37, and change their diaper and sing them to sleep. It
Oh
was
no.
lovely, but it was 45 minutes.
Oh my gosh.
Although after that, I will say, then he looked at me and said, "Then the vortex comes," and he started throwing them around the room. And I realized he was telling me his life story because life was wonderful with his mommy and his little sister until his dad got out of jail. And then the vortex came and it was chaos.
Oh,
And I was like, that was worth 45 minutes of boredom because he just told me his whole life story.
that's sweet though. I mean, like that he felt comfortable enough towards the end to do that.
Yeah.
Yeah.
And I think that's part of my big problem is I know I talk way too much because I get nervous, but in that silence, when you give the patient that silence so they can compose themselves, and it may lead them to another thought, and it comes from them. You know what I mean? So it's a lot more um meaningful. I thought that last week I was throwing out way too many ideas. And I'm like, this is too much stuff because I end up like, as I think it, I say it, and I shouldn't do that. Um, but, I thought, especially when you were being the client, you did such a wonderful job of
Okay.
just kind of going into and kind of thinking about stuff. Um, and when you were being the therapist, again, you were doing this great job of just kind of letting me run with it because I was just making stuff up as I went that wasn't in the paper. And you were running with it and you were right there. I thought that was fantastic.
Well, thank you. I felt like you did the same thing though. It's a very natural interaction between you and
Yeah.
I. It's not scripted. I don't think either one of us even like using the empathetic statements at the right time when they're authentic, being attentive and having the active listening, some of the gentle kind of things, just kind of gently nudging each other in the
Yeah.
right direction when we needed to have more of those leading questions and things like that. I think it comes with age and practice. I mean, when
Yeah.
I first had clients years ago at WIC, I was like 20 something. I'm like, what do I say? What do I do? And you do have kind of that scripted thing in your mind where you're like, oh, I've got to cover this, this, and this. How do I get there? But now I've learned to just, part of it I think too is the dictation, or the charting while you're in with the client. So part of it is you can't really engage because you're charting, and then the other piece is it's like you're right. If you just wait, they tend to just keep talking because they don't like that uncomfortable silence. So they continue. So while you're doing the observation, and especially if I feel that there's more to it, like you just kind of get that intuition where you feel you've got to kind of delve deeper, I will stop typing and just sit back and,
Mm.
and just, or I'll sit like this.
Yeah.
And then it kind of makes them uncomfortable. So they do start talking more, and then they just don't stop. So that's like you kind of glean really a lot of what you need by that.
Yeah.
I think it's pretty interesting. Or just watching the way that they are. Like this morning, I had a guy who's completely under the influence. Had I not stared at him for a few minutes, wouldn't have caught it. He kept looking down, and I just thought he had poor eye contact. And then he looks up and he's just glazed. So had an ankle monitor on. I mean, it was just kind of wild, but
Lord.
so things like, the nonverbals I think are just as important, and you know them as well as I do. That kind of gets ingrained in you from the very beginning of your career. None of this, none of the closed off body, boring tapping like you're, you
Looking at your watch.
right. Yeah. Yeah, that kind of stuff.
And I had always heard too that you know that you're making a connection when you start shadowing each other. Like you realized they're sitting the same way that I'm sitting. And I've noticed that both of us kind of lean in because I'll be like very aware in the beginning. Okay, you're supposed to see, but I talk with my hands. You're supposed to see body language, so let me back up. But then I'll be like, "Mhm, okay, and it's like, sorry, that's my body language.
I just think it's kind of hard too with the Zoom. I mean, you're not sitting across from each other, and I was always taught too, like, this is the first time I've ever done therapy or counseling or seeing patients of any level with a desk in front of me. So in the
Yeah,
past, I've always done it with the desk in the side where the area is open so you can match full body language, and
right.
you're looking for those cues, with the lower half of their body, or you're looking for tardive dyskinesia, like, I mean, you know,
Something.
you're
Well,
getting the whole picture.
I'd heard too that the perfect setup is a corner. So you're kind of like this, they're kind of like this. So they can look off at them because sometimes eye contact is hard. And sometimes, like, I don't even know if it's true, but they say if someone's making something up, they look up. If someone's, thinking about something, they look down. But I know a lot of times if it gets very emotional, they can't look at you. So that gives them that option. And of
Mhm.
course, you got the tissues on the table between you. So you're
Right.
good. Um, something you said, it kind of reminded me of, before we were recording, I was saying how Rogers just drives me crazy because to watch him, I'm like, can you help the lady out?
Yeah, that's a pretty intense.
They had, it was only 2 minutes, but it was a lady, she must have been from the 50s or 60s, and she was divorced, and she was talking about her 9-year-old asked her if she had sex with anyone but their father. And she, of course, is dating people. And she's like, well, I wasn't sure what to tell her. And I'm thinking, no, no, this is not a conversation for the 9-year-old. She's
No,
not your friend. Um,
right. Very
and he's just
inappropriate.
like, so you're wondering. Mhm. So you're wondering. You wish I could say something. hmm And I'm thinking, try doing that with an adolescent, and they're just going to be like, are you even paying attention?
Even an adult would do that. They like, what am I here for?
Right. Right. And that's what I would always tell parents is you have to be careful with your kids. Like, because I think on some level, when they're like 2 and we're saying, what color is that? What color is that? What color is that? They're like, don't you know? Because you're so much older than I am and you seem to be in charge. And I think there's a little bit of that with clients is that you don't want to answer a question for them or make a decision for them, but it would be nice if you had some ideas to throw out.
Right, like they're looking for you for guidance, especially when they're younger, or some adults too as well, and they come to you for the answers. They're looking for that authoritative, they want and a lot too. I feel even with the adult population, using those close-ended statements where you're just like, okay, thank you for sharing your thoughts. This we're going to go over, and then a lot of times the clients will burn out. So what do you think I got? you know,
Right.
it's not like, okay, you've got bacteria streptococcus, like, I mean, so we'll
Well,
talk
I think
about that
part
as
of the thing with mental health is if we're ever going to take away the stigma, why can't we say, hey, it sounds like bipolar disorder, and this is what this means, and this is how, your brain's just a little bit different. Um, so here are some things that can help.
Yeah, and I do
Isn't that?
that. I do a lot of the education because I feel it's important for them to be empowered. Not a lot of providers do that.
But I think there's also a lot of good in saying to someone, why don't you just do XYZ? And if they come back at you and they say, because that's the stupidest thing I've ever heard, perfect. Because I
Yeah,
would tell kids that my job is to make a guess, and your job is to tell me if I'm wrong. So if I say, well, based on what you said, why don't you just blow off school and go to the movies? And then they can say, because Melanie, I'm going to get in trouble again, and this is going to happen. Okay, then we just work something out.
yeah.
So I don't know. But I can see some good for being Rogerian, but I think you just got to have everything in your toolbox and throw out whatever makes sense.
I would agree. I mean, there's just you just can't. I almost feel like it's also a lot of that the restating. I felt like that's all he really did was just like, okay, so you're so what I hear you, what do you want me to do? Mhm, mhm. Just,
And why can't when she said, I just wish you would. Part of me wants you to say, tell me what to do. And instead of him saying, oh, you wish I would tell you what to do, but I'm not going to do that. Why can't he just say, you know what? I could tell you what I would do in the situation, but I'm not you. And it may be wrong. So, here's some self disclosure. Here's what I would think of doing. What do you think of that? And then she could either say, well, I'll try that, or no, that's stupid.
right, because you're giving her a choice rather than just saying I'm not. Because what I hear in that statement when he said that is no. That's all I hear is you're not going to help me.
Right. Right. Like I just talked to the wall. And at some point, I just wanted him to say, well, let's think about this. You're your 9-year-old daughter's mother. Do you feel comfortable having this? Is this information that she needs? Because I guess the children's therapist part of me was going, nope, nope, she's not your friend.
Yeah,
Don't be your kid's friend. No good comes of it.
way too inappropriate.
Well, or as my mother would say, she wouldn't take the demotion. See, self-disclosure. We actually had that discussion. Why
Yeah,
aren't you my friend, Mom? Because I'm not taking the demotion. I'm your mother. Okay,
great. I'm not here to be your friend. I'm here to teach you. So,
right, right.
and it's hard for many, like those people in those instances too. It's like they have their own social issues or their own,
Yeah.
parenting issues, and so then they look at they want to be liked, and then they're this little best friend, and I have one client too. It's the young girl, and she has issues with her mother, and she told me that they started when her mother would dress her up like her twin all through, being little, grade school, kindergarten, all through junior high. So like eighth grade, she finally rebelled and was like, I want to wear what I want to wear. I want to do my hair like I want to do. We're not twins. And the mom took that so personal that ever after that, they were enemies because mom felt that, and then every time, so she tries, so now she's a young adult, she's in her 20s, early 20s, and lives at home with mom and suffers from lots of depression
Mhm.
because mother manipulates and tells her she's not successful and she's always going to have anxiety and she's never going to do anything and this is why things fail. So then she goes and tries, and the mom gets way too involved in her life, so she's back at home and she really wants to move out on her own, but then mom chases after her and says, I can't be alone, you need to be with me. And so there's this very unusual dependency,
Yeah.
dependent personality disorder from the mother. But the daughter's very, so it struggles with that too. So that's what kind of reminds me of that situation. That's what I think of, is someone trying to create dependency by, having a little mini human. It's
Yeah.
not a pet, it's not your dog that you
You dress up like.
to,
Well,
right?
and a lot of parents will say, I don't want my kid to be mad at me. And I'd be like, well, then how do you know you're doing your job right? If you're doing your job right, your kids, listen, it doesn't matter what you do. At some point between, once puberty hits, at some point they're going to hate you. But that's wonderful because if the child has two parents, the safe parent is the one they'll lash out against. If they think dad is only in my life sometimes, and I have to be really good, or he may abandon me, but
Uh-huh.
mom is here all the time, so I can take all my anger out at mom and she's not going to leave. You've won parenting. I mean, you have to give them boundaries, but that's showing they have such trust in you. They can be awful and you're not going anywhere.
I never thought about that. That's actually a really great point. No wonder my kids are me.
That's my personal theory. My
Oh, I,
personal
I would
theory.
say that's a pretty good
But
theory.
but I mean, you see it all the time with kids whose parents are no longer together and maybe
The
one
Disneyland
hasn't
parents.
been parented, so they don't know how to do it.
Yeah, the Disneyland dad, and the kids are always well behaved when they're there, and they get treats and blah blah blah, but they don't know when they're gonna go back.
And
Yeah.
what message are you sending your kid? If you're one of, what do they call them now? The snowplow parents who will do everything for the kid. It's like the
Oh
um,
yes,
the actress who spent $500,000 to get their kid into school.
yes.
What's the message? She's trying to send the message, I really love you, I'll do anything for you. The message the kid may be getting is, look, you're a loser, you can't do anything on your own. I'm
Mommy,
gonna have to do this for you.
mhm. And mommy's always going to, so why? I mean, it's enabling.
Yeah.
Ugh. I mean, I see that in adults that still live in their grandparents' parents' houses at 40.
You were saying that that's common down there.
Very common. It's like the one patient I think I told you about with the parents that brought her in and was like, oh, she needs a long acting. She's unstable. She's lost her kids in her marriage because of her illness. The whole time she was smoking weed, not taking her risperidol. And then finally she comes in forwardly just manic. And I was like, there's no way that you're taking 8 milligrams of Risperdal and you're seeing things and talking to angels like you're on drugs and a UV ester. And sure enough, yeah. And then it came out, and so it's things like that enablement and not setting good healthy boundaries so that children can learn. They're just too busy helicopter parenting or snowplow, like you said.
And
So
sometimes you just got to be the therapist who says, well, you can't have your kids right now. You can't be a parent like this. How can you be a parent? Look at what you're doing. You're being a kid right now. You got to pick. Which one do you want to be?
and
Because
yeah, absolutely.
we're not going to, you're not going to be an effective parent if you're smoking pot all the time. You can't help them. So, yep, we got to find a safe place for them. And that's a good mom, too. A good mom says, I can't do this now. Let me find a safe place. And you may work on yourself and you may get the kids back, or you may say, this is not something that I can do. So, what you've done is you have found a safe place for them. See, I always kind of feel I don't want them to think because I will say to parents, you can't have your kid right now like this, but I don't want them to think that they're failures. So I
Right.
want them to think you still have your choice, and whatever decision you make is the right decision for you. And if you're, letting your kid go into foster or whatever, and they're safe, that's a good parent.
It's a selfless action. That's what I
Oh,
often tell
absolutely,
them. Yeah.
absolutely.
I think that's something like one of these questions that we're supposed to be mulling over here is the quality of your engagement, your empathy. I think that we both have pretty good radar when it comes to things like that and being very humble
Yeah,
and trying to better understand where you're trying to meet that person where they're at rather than bringing them to your side of the table and saying,
right.
well, you're going to come into my middle class life where I have first world problems, but I don't know what it's like to live in a house with roaches or struggle with food stamps or not have a car. So when you meet them in that space where they're at, then you can really just kind of envision yourself in this situation, and your empathy is more authentic, I feel.
That's a really good point. There was a question in one of the workbooks, and I can't remember exactly what it was, but it was like that. It's like, well, what would you say to somebody who says, well, you just think you know everything because you're a counselor?
Mm.
I don't know what your life's like. I wouldn't be able to do this. You've got wonderful strengths. I wouldn't be able to do this, but you're doing it. Tell me how you do it. If you throw them back to them.
Absolutely. And just even acknowledging, I feel like that's also an authentic empathy type, that's authenticity where you say, I can't imagine what you must be feeling or what you've gone through, but I can say that, I admire your strengths, and you kind of build that up a little bit, that kind of stuff too. And like one of the questions here I was reading, where you feel times you felt more confident in your responses with the client. I think those come from, if you have that kind of situation, you're like, oh, I know, like you feel empowered, and maybe from past other therapeutic sessions, or you feel confident in that department, and so then you're like, oh, I know what to say. But other times when you're not, maybe in those uncomfortable spaces, like
Right.
um, I'm trying to think of one. I can't really come up with one off the top of my head, but um, I'll give you an example. So I have this one patient today. I was like almost one of the last ones. He is fixated on the fact that he has not gotten disability. And a
Uh,
big part of it is because he can work and he's able, and he's trying to, he has a long history of abuse, and he's trying to milk the system, and the system has caught on based on conflicting evidence and things. Like he says he has a seizure history and all his EEGs are fine and things like that. So I have only, this is the third time I've seen him. Other providers had seen him, and every time he comes in, he has an attitude, he is late, and he just completely wants to talk about the fact that he's been cheated out of X amount of dollars because his disability, and this lawyer should have done that, and this doctor shouldn't have done that. And then he'll ask for more benzodiazepines, which he shouldn't have in the first place, but he's on it, so he can't, just stop it.
right.
So this client in particular today, this is the third time I met him, and every time I have felt less confident with him, because it's like, how do you keep redirecting him? How do you get him? And so finally I was very direct today, and I was firm with him today. And I said, look, when you come in here and we talk about things, we only have a limited amount of time, and it's to focus on your medicine. It isn't to focus on what's happened in the past with your disability. I understand that you're very frustrated. However, I do not have any impact on that other than to meet with you and discuss your medications and chart your notes and provide those for your case. But then he'll, go on. He was mad about this neurologist because he's trying to build this disability case where there isn't. He's trying to appeal again. And he's like, she won't give me an MRI. I think I have a brain injury, and again, venting out on me. So then I had to redirect again. And then finally at the end, I said, look, we're going to have this very frank conversation. I am not going to give you any more Klonopin. You have been told, not by me, but you've also been told by other providers who have documented that you've repeatedly asked for more benzodiazepines. And he's literally had everything on the block for anxiety. He's got propranolol, he's got, an antidepressant, and he's got, I don't even remember all the things he has, Buspirone. I mean, he has it, and it's all maxed out. 200 milligrams of Zoloft. I mean, so there's no reason for him to still present this way, but he's fixated on this. So, and finally I said, where's it going with your therapist? Everything was negative. So then I finally flat out said, you need to fire your therapist, and you need to find one that you relate to, that you feel that you can make strides towards this, because medication is not going to fix how you feel about your disability case. And, and then he was just mad. I mean, he was mad. He's like, you're not going to give me any more gabapentin. He was at 900 milligrams of gabapentin with all these other drugs. And I'm like, no, and I'm not going to give you anything that's going to give you an altered mental status or make you feel high or intoxicated. It's not going to happen. And so that made me actually feel less confident today. And I could tell that he was getting me worked up, which is very rare. And then I get heated with a patient. Yeah. Like, he just kept, and he was like slapping papers down, and he was, just very intense and aggressive, trying to bully me into giving him something for his anxiety. So I did feel stuck today. And I finally, at the very end of it, I said, look, this is what I'm going to do for you. I hear that you need to sleep, and I hear that you're having some anxiety. So let's adjust this, and let me give you this for sleep. But he has a problem with high cholesterol. So he was on Remeron, which increases cholesterol to like the thousands. And I caught that, and I took it out, and now his cholesterol is back down to normal. Good. But then I had to explain to him, like, I can't give you, these other things that do the same thing. So you're very limited in what you can get now because of your history, and you just need more therapy. You need more intensive therapy. So finally, I just was like, what would you like me to do for you today? What can I help you with? Because this is my boundary.
Right.
And he just kept on and kept. It wasn't, but I got like, my heart rate went higher, and I was getting upset. And so finally, I just looked at him and I said, David, you need to give me 5 minutes. He's like, you need to give me 5 minutes of your time to listen to what I have to say. This is what I'm going to do. This is what the plan is. And you're going to come back and see me and blah, blah, blah. Any questions? And then he was, so he like that, times like that, you have to kind of just get in and be direct, and
No, I thought it was great, because you're giving him his boundary. We're not going to do this. It's not working. This is not working for you. And as you're telling this, I'm thinking, do you want to be disabled? It's like the parents who come in and it's a custody dispute and they desperately want me to say that their kid has been abused. And the
Mhm.
kid's fine. And finally I say, okay, do you want your child to be abused? Because I
100%.
don't do that. And they'll just be looking at me and they'll be, well, no, I don't want your relationship with your ex is different from your child's relationship. Plain and simple. You can't redo it on here because then you're abusing your kid. Oh, but I mean, I love the way you just spelled it out to him. This is what we do. This is what we talk about. We are not going to go all around this stuff that neither of us have power over. This is what I can do for you.
But and I felt that part went through me. He wasn't happy, but the part that I didn't like that came through was that irritation. I was getting frustrated because I kept trying to keep it calm and reiterate and redirect, and he just kept coming back. And it was also very negative attacking towards not necessarily myself, but my facility and my people, because he was like, well, these past notes documented that's why I lost my disability, because you didn't document enough that I had debilitating anxiety and things like that. And so then I had to correct them and be like, well, to be fair, we've only met 3 times. So I can't speak on behalf of someone that you saw before me.
Right.
Because he was like, well, these notes better be more in depth. They said that I lost because these notes weren't good enough and things like that. So he was really just trying to badger and take out his frustration. And so I didn't like that he had gotten under my skin, so to speak, and that I was impacted, my emotions, my thoughts. I was just kind of burnt out afterwards. Body language definitely wasn't there. Like, I actually stood up and and was like, okay, let me take you out to the waiting room. I was like, we're done here, basically. And I had given him like 50 milligrams of Vistaril to go to sleep. Sorry. And they're playing
Oh, okay.
because of his, increased triglycerides and some other medical issues. So I gave him hydroxyzine because, he's an addict. He's a history of addiction. And he's like, really? You're only going to give me Vistaril? And so, because I didn't want to deal with him again, I gave him a 3-month follow-up because I hadn't changed anything else. But then afterwards, I was like, okay, you let this guy get under your skin. So my reaction was to be upset and to get him out of my office. I didn't want to see him again. So I put him out for the longest appointment possible, but that really wasn't good service. Like, I should have followed up in about a month for the sleep, you know.
I'm I'm kind of seeing it a little bit differently because you use what works, right? So what's worked for him in the past was his bullying behavior.
Mhm.
And it kind of worked because it got under your skin, but then it didn't work because you're like, nope, nope, we're not going to do this. This is what I can do. You've come to me as a professional. I'm giving you my professional opinion. If it's not working with your therapist, fine, get another one, because it may work. But for you and me, here's our boundary. Here's what can happen. And you know what? You're doing okay. I don't need to see you for 3 months. You're not acute. So, to me, I'm thinking, yeah, he got under your skin, and I understand that can be real uncomfortable. But he had a different experience. His experience was he got under your skin and you pulled it back and said, okay, no, I'm still in charge. We're
Mhm.
still working together. I'm not going to do what you want just because you're bullying, but I'm not going to I'm not going to fire you as a patient. I'm still going to work with you.
That's true. I never really thought about that. And, one of the things I did point out in his interview when he was kind of bashing providers in general, I had told him, he's like, well, what exactly can you do for me? And I was like, well, to be fair, I am the one that caught the fact that you were on a medication that was increasing your triglycerides. And now we've made a marked improvement. Now they're back within normal range. Like, I am on your side. I am trying to help you, and I'm trying to improve your health. And so, to think that I'm not trying to do anything for you, because he'd accused me that of earlier. So it was kind of, um, kind of showing him in a way. And you're right, I guess, because he's used to getting his way
Mhm.
with other providers. I didn't really think about that. That's a really good point.
You're still doing that positive regard. You
Um,
do your behavior is inappropriate. and you're being bullying, and I'm just going to tell you it's not going to work with me. Good luck elsewhere. It's not going to work for me. But I'm also not going to say, you're a bully, I won't work with you. I'm still going to work with you. You still seem like a nice enough guy, but you can't be doing it that way. So we'll still work together. But you know what? You're doing such a good job. I'll see you in 3 months. And then in the back of your head, you're like, I don't have to deal with you for 3 months.
Yeah. Listen, yeah. Yeah. So, and I guess, yeah, I guess that's good.
But I think that's part of it is just being hard on yourself and, what should I have done? What could I have done better? It's like you have an argument with someone and on the drive home 2 hours later, you think of the perfect thing to say.
That's true. And in part, it's like at the point too is you recognize that he has drug seeking behavior and you recognize that he's trying to get the disability, trying to badger to get that disability for me to write something in there so that he could, at one point he was like, oh yeah, can you prescribe the MRI because she won't give it to him. Like, no, that's, well, why not? Those kinds of things. So anyways, I guess we should move
Yeah.
on to the therapy.
Let's behave and we'll.
All right.
I always feel sorry for the instructor because she's probably like, ladies, can you get to the role play?
All right. Right. Hopefully she'll just fast forward.
I just love talking to you. I learned so much.
Same. I do too. And it's great to like she wanted us this week to just talk about our actual therapy session and what we could do. But I don't feel like the situation that we had, that was a lot easier client, I guess I'm trying to say.
Yeah.
Like, talking about other scenarios with you, like we've been doing, kind of helps think outside of the box with those little more difficult cases, just kind of based on our background.
Yeah. And I think that's a big part of it is to remember that we're back to kind of square one here, which can be helpful in some ways. And then in other ways, it's like, you know, you know, you know.
Yeah, at least you remember like the terms and the people and all that stuff. I don't remember nothing. I mean, that was like 12 years ago. I took psychology. So I was
When
like, oh gosh.
when I went back to nursing school, the school was changing places and they were a little scattered and they lost some of my transcripts and I kept sending them and finally I'm like, I'm not going to send you anymore. So they were like, well, some things have changed and you have to take Psych 101 over. And at first I thought, no. But then I thought, I took Psych 101 in 1982. That was 3 DSMs ago. So I thought, okay, let me go back and see if there's anything. And of course, things have changed since then. So I'm like, okay, well, this is good. And like I say, I love that they finally put in the books. The only important thing is your relationship. Because I think that takes a lot of pressure off.
Absolutely. And every person, every encounter is going to be unique in its own right.
Yeah. I'm going to try to be Rogerian.
Yeah.
I'm going to try to be Rogerian because I'm not good at that. I will fail miserably at it, but I'm going to try to be Rogerian. So, what's your pleasure? You want to be therapist or patient first?
What did I do last time? Patient first. I guess I'll do therapy this week. All right, let me pull back that last week's scenario so I can refresh.
And I just moved my phone so I can see what time it is. So we will not have 45-minute sessions, although I would like to schedule a time with you for myself, my own.
I feel like it's free therapy every week when we get together. It's great. So I guess, yeah, and I think we could just do this very abbreviated. I don't think
Yeah.
the big stories. I mean, we can really treat it like a 5-10 minute, med follow up or whatever. All right, where are we at? Therapeutic video, week 3. Okay, so, all right, whenever you're ready. Ready?
Okay, who am I?
Okay, so you'll be the client, I guess.
Okay, I'll be the client. Okay. So I'm coming back for a follow-up session after last week, and my issue is that I went back to school and it's a lot harder.
Right.
Okay.
Okay. All right. Yeah, you had some increased sleep difficulty and some irritability. So just stress. how humiliating it would be to fail, I think is what it was, right? So, okay. So
Okay.
it's just more working in the here and now rather than that past and future kind of type stuff is where I'm going with this. All right.
Okay.
Hi, Melanie. It's good to see you again. How are you today?
Hi, I'm good. I tried some of the stuff that we talked about last week. Um, and it's going kind of better. Um, you told me things about like um not having to be perfect all the time and getting some help. So we had a family meeting and I talked to my husband and the kids and I said, well, I'm in school now. So that's going to take some of my time. So I said, well, I'm going to study while the kids are in school, but 2 days a week, I'm not going to make dinner. And it's going to be up to my husband and kids to make dinner. And we had pizza,
That's great.
which I always said I would never be that mother who makes pizza or buys pizza. I always want to make like a meal with 2 vegetables and a starch and a protein. And I always want to have the kids, you know, not clean their plate, but eat as much as of that before eating snacks. And 2 days a week when it was their turn, we had pizza and ice cream. And it drove me crazy, but I didn't say anything. But all I could think is they're going to get cavities and they're not going to get their nutrition. And wouldn't it be just easier for me to do this? So I guess I'm having trouble letting go with that. Now the working mother in school is working great. It's working great because I come back from class and I go home and it's quiet and I can get some of my studying done. And I actually took a test this week and I passed it.
Wonderful.
Yes.
Great.
But now my worry is that my kids are going to be malnourished with cavities all over the place because they're going to eat pizza and ice cream all the time.
So let's talk about that a little bit. Using some rationalization. If they're eating 2 out of 7 days, right, poor food, and 5 days of those weeks you're cooking this well balanced meal with, giving them good nutrition options before the snacks. Is it really feasible to think that they'd have calories, especially I'm sure they're brushing their teeth twice a day and other meals during the day they're probably eating very well, right? At lunch and breakfast. So
They are. I guess I'm having a hard time with letting go of that wanting to be still. I mean, I feel like I'm not going to be the perfect student. I'm not going to get all A's, and that's okay. I just want to pass. And I'm still going to get into some arguments. I will say my husband's doing a lot better. He actually loaded the dishwasher this week. He did
wonderful.
it wrong, and we argued for about 20 minutes about that. And finally, he just said, okay, if the dishes don't get clean, then I'll do it your way. And the dishes got clean. So apparently, there's not just one way to do that. And he's even said that maybe he can do the laundry on the weekend um, so that I can use that time to go to the library, which is wonderful. But I'm biting my tongue because I'm like, you're going to do it wrong. So I guess I'm thinking I'm letting something slide and I just feel like if I'm not doing this perfectly, then I'm letting my kids down. But I can see what you're saying that pizza's not that terrible and it's not like they're eating candy. I know when they're over my parents, I know that's what they're feeding them because they come home so hyper. And I'll be like, did they eat good for you? And both my parents will say, yeah, they did great. And I'll say, well, what did they have? And they'll like They'll say, "Oh, they just had some food," so I know they're eating candy. So I guess it's just hard to let go of some of these things. But on the other hand, in some ways, it's getting easier.
Well, I think focusing on the fact that you were able to even have the discussion with the family and to delegate the dishes and have your husband feel like he's empowered to help and that you're willing to accept the help. I think that's a huge step for you. Even to just kind of say, okay, I don't like having the pizza, but I did it. And that in turn gave me time to be more successful in school. I mean, those are great steps. And then in turn, what I'm hearing is that your husband now feels empowered to help more because he's recognizing that that helped you and he cares enough about you that, he wants to help you be successful. So he's offering up the laundry, which again may not be, ideal. He might wash things and shrink things and stain things. But is he really going to wash and ruin every piece of clothing if he does that? Probably not. Right?
I like that word you use, empower him, because I didn't think of it that way. I thought I was taking stuff that was my responsibility and shirking that responsibility and making him do it. But when you said empowered, that's like the opposite, right?
Absolutely. How does it make you feel when you help someone?
Well, I really like to do that. I like to do that. I like to help people. I like to, it, it may be selfish, but I like when, someone doesn't even have to say thank you, but when they just look like happy for that, I feel like I've made them happy and I'm being useful and I love it.
Right? And I imagine that your husband kind of feels that way by you allowing him to do some things to help you.
I see what you just did there. I see what you just did there. So that empowering is letting him know that he can be more useful around the house,
Absolutely.
which he really is being, because it used to be he'd come home from work and he would sit down and he'd watch TV and he would kind of play with the kids a little bit, but he'd just be like, "I'm exhausted. I had to," and he does work hard. He works in construction and that's a lot of physical work. And I know he's tired at the end of the day, but it seems weird, but the other day when it was a pizza night, and he said to the kids before I could say anything, "Okay, mom's not gonna clean up tonight. Let's clean up." And I was sitting there and I watched them, and they each got their plates, and my daughter got my plate, and I brought them in, and I thought, this is kind of what I thought a family would be like. I felt a little guilty because I wasn't doing it, but they were kind of including me because they were asking me some questions. So I kind of feel, on the one hand, I feel guilty because I'm getting help, but on the other hand, I really like it.
Well, that's good.
So is it okay that I like that they're doing?
Absolutely. And if you think about it for a moment in their shoes, you kind of look at it as in a different angle. You're looking from your children's point of view or your husband's point of view. You know, you've always worried about putting that burden on them and wanting to make sure that it's perfect the way that you view perfection should be. However, if you're looking at kind of from the perspective of your husband's point of view or the children's point of view, like you said earlier, you spent 20 minutes arguing with your husband about the perfect way to do the dishes, which you felt was the only way. Perhaps, though, in the past and even now, your husband has hesitated to help, or the children have not wanted to get in your way, so to speak, when you're doing things because they felt like they couldn't do things right. So now that they're helping you and you're allowing that to happen and the dishes did get done, that also helps your husband feel I can accomplish something too. I can be useful. I can be of assistance. And there's kind of a middle ground between the two of you where you're also recognizing, okay, there isn't just one way. He did it a different way, but the dishes still got clean.
They're
The
clean.
children were able to get up and pick up plates and ask you for your
Yeah.
help, and they empowered them to be useful and helpful. So it really benefits to balance things out. And I think the key thing here, Melanie, is you spend a lot of time reminiscing over the things in the past and how things should be in the future, worried always about this vision of perfection or how things should go in your day. And instead of looking at what's overflowing and chipping away and delegating those things, you just kept piling things up like a stack of hot cakes. And they're getting wobbly because it's such a tall stack of hotcakes, right? Instead of sharing your hotcakes with your family, you're hoarding them to yourself. So when you think about that kind of analogy, when you think about all those pancakes, right, all those hotcakes, and now you're sharing the hotcakes, everyone in the family can feel like it brings them together. You're having a hot cake meal and everyone's getting to share the good, yummy goodness that comes with syrup and butter and hotcakes. So, so by doing that, it also brings it to, I think, importance of focusing on day to day instead of worrying about what could be happening in the future, worrying about what you've done wrong or couldn't do good enough in the past, and just taking it day by day. What can you do today? What can we do for dinner? What can we do to kind of just, delegate? Maybe there's something else that I'd be willing to part with so that I can get enough time to be able to sit down and maybe do this lesson for school or get a little more rest. And just if maybe just rein it in a bit and try to just focus on today. What can you do today without worrying about, oh no, if I don't do this today, X, Y, and Z, the children's clothes are going to come out this tiny, if my husband does the laundry. So just saying, okay, well, today, I need to do this paper. So let me see the laundry's piling up. I'm going to have my husband do the laundry. I'm not going to give it any more thought. And then kind of put that image and worry of the laundry. If you envision a mental bookshelf, you just take that worried thought about the laundry and your husband and you put it on the shelf. And then you say, okay, now I'm going to focus right now on this paper that I need to write. And I'm not going to worry about the laundry for right now. It didn't go away, but I'm just going to put it on the shelf. And then you focus in the here and now on the paper that needs to be done.
Wow. Well, okay. I'm going to do it. I'm going to let him do the laundry because I do have that paper to be done. And I'm going to try to focus. I like that, to focus on the here and now, because that does help if I'm not worried about that. And he can't mess it up too much. He really can't.
And if he
So
messes
I'm
up
gonna
the
try.
one load, then we don't
Pardon?
let him do I said, if he messes up the one load, we don't let him do the laundry, or we teach him how to do the laundry, right? This few minute instructional video of, well, let's not use the hot water setting. Let's use the cold water. He might need a quick tutorial, but it's not all of the clothes that he ruined, right? It's just, it's the one load test. So that might help as well.
I guess I can't expect him to know how to do it if he's never done it, because he's never done laundry before. So maybe I'll do that. I'll explain to him, like I'll show him the first load and how to do it and how to sort everything. And then he can worry about that. If he could just fold them, he can fold them. He can do that. That's the big part. And then that'll free up some time. It's a little scary letting this stuff go. It really is, because I feel like I'm giving up a part of myself, but I like how you said that it's empowering them. And I can see it's empowering my kids too, because hopefully I will not be doing their laundry when they're 30.
That's right. You got to share some of those hot cakes, right?
Yeah, I like
They're
that.
never going to know what hot cakes taste like.
I like that.
So
Okay, so I'm gonna do it, and I'll tell you next week how it goes.
that sounds great. Anything else you want to discuss real quick before we go? Any concerns or questions?
No, I think everything else is going okay. Um, I like that you didn't tell me not to worry, that you told me to I could worry later. I like that, because I know I'm not going to stop worrying, but I like, and I'm going to try to kind of stay in the present and in the here and now.
Good.
I like that. You really make me think about things differently. I like that.
Good. I'm glad I can help. And so we'll book another appointment and we'll see you next week.
Okay, thank you.
You're welcome.
That was really good. I like that hotcakes. I'm stealing that.
I love analogies. I use them all the time. All the time. That's how I think in terms. If it's a mental, the hot cakes, the car with a little bit of gas versus a full tank.
Yeah.
Things I tend to do that. I've always the provider that I trained other. That's what he did. He would always use like visuals, and then it would
Yeah.
make me laugh. Yeah.
I like that visual. I like that visual. I almost said it's her. I'm going to put a book next to me when I study, so I know that's the book with my worries, to put somewhere else. Because okay, that was good. That was 15 minutes.
Yep. Exactly 15. Yep.
Okay, you ready?
I'm ready.
Okay. Well, hey, Darlene, welcome back. How was your week?
It was pretty good, Miss Molly. I just, I took some of your tools to heart and really tried to implement them. I tell you, it was hard for me to think differently. As soon as I got back home, I just immediately was overwhelmed. Even just coming to the appointment, I got home and there was stuff everywhere. My husband was sitting up his feet up, just uh, the kids had tore up the house, like playing cops and robbers and tent forts everywhere. And I just kind of had a meltdown and had to go to bed and really wasn't able to be successful with my schoolwork. And then in turn, that put me into feeling more stressed out and being more behind and overwhelmed. And, then I just kind of got wrapped up in that kind of dark cloud for a couple of days. But the last day or two, I've tried to come out of it and tried to tell myself, be a little more gentle and kind of get back up on the horse. So, I don't think I really made a lot of progress from what you told me last week.
So let's see. So we talked last week and we talked about some ideas, and you got home and it wasn't magically different.
That's right. I would say I did. I thought like just that one visit, I was going to go home and everything was going to change and my thought process was going to be different. And no, it almost felt like it was magical that I pretended I came and saw you.
Oh, well, it was real. So what piece was missing? So we talked about these things and you got home and everybody was acting like they act before. So what piece was missing? You and I talked about something different.
Yeah, I just think it was just overwhelming for me. Like I couldn't even remember like all the things that you told me. And I just felt like I really felt like when I left last week, it was like I felt very relieved that I was able to share all of the stuff that I felt. But I feel like a lot of times too, my anxiety and stress just kind of clouds my memory. So it's hard for me to remember things and hard for me to focus. And so I got home and I felt like all the tools, everything we talked about, I was like, I can't remember. I don't know what to do. I just started crying. Like, it just, when I walked in the house and saw stuff everywhere, it was done.
Well, you and I talked about some things to do differently. And you did a wonderful job and you talked about, your anxieties and ideas.
I
But when
tried
you
the
got home,
breathing. I did try the breathing.
good. Did
I
it work?
did. I did. Not when I came home. I was hyperventilating. I was like, oh, because the house was really bad. But a couple days later, I did. I actually was going into class and started to have like a panic attack and sat in the car and did the kind of 555. So that was good.
Did it help?
Yeah, it did help.
Yes. Um, the piece that was missing is we forgot to tell your family that things were going to be a little different.
That's true. Yeah.
So we were talking about some nice ways of delegating things, but we didn't tell them. So when you came home, was it kind of business as usual?
Yeah, and I just felt like I wanted, like, I almost like I felt like I expected a change because you and I had talked. And you're right. They hadn't talked to you. They hadn't talked to me. They didn't know. But I guess I kind of felt like, okay, now that we've talked, we've got a game plan. And so when I go home, is when magically everyone was going to be on the same page. That didn't happen.
Well, and change is hard. Change is hard because you get comfortable in what you're doing, and your family's comfortable in what you're doing. And in a family, when one person says, we got to change. I'm not comfortable. That's scary for everybody because then everybody has to change. It's not saying it won't lead to good things, but we're programmed. Every time you have a new experience, your first um, emotion is fear. So even the first time you had something fantastic like ice cream, your first emotion was fear because it's different.
That's true.
So tell me what happened. You said it was rough the first couple days because the magic fairy didn't come and wave the wand. If you find that magic wand, let me know. I need one. That didn't work. But what happened the other days when you said you started feeling better?
Well, I did remember, like, when we had talked about before, where you really helped me kind of process things and recognize that I am human and that there are going to be days when I'm going to feel overwhelmed, and that's okay. And
Yeah.
to keep trying and work on, focusing on things that I can do and kind of delegating the kids and stuff. So I felt like the first couple of days when I broke down and felt overwhelmed and got depressed, and then I started thinking, well, how can anything change if I don't put to use what you told me? Like, it's like a broken record. If I come here and I don't take away any new tools, then nothing's going to change. It's going to still stay the same. It'd be like just having coffee with a friend.
Therapy is work. Therapy is hard work. Sometimes it's nice to be able to kind of think things through, but then in between our sessions, you have a life. So that's where the hard work comes in. So what did you do? What hard work did you do this week?
I started to think about things that I could do to delegate and things I could put off. Like cleaning my garage. That doesn't really need to be done until maybe Christmas break. Um, Asking for more help from friends and family to play with the kids and kind of redirect them so that I could focus a little more. So a couple of things like that. Taking a little more time out for myself, taking a hot bath, or just something simple like his suggested, just taking 5 minutes pulling over before I get home. That was a big one.
Did you do it?
I did a couple of times. It was funny at first. I just felt like I was sitting in this parking lot going, what am I doing? I need to be home. And, I'm going to be late and dinner's going to never get done. And then, like, the second time I did it, then it was like, okay, yeah, you need to just kind of leave work at work and
Yeah.
go home with kind of a fresh attitude. Excuse me. Excuse
Get
me.
a nap in?
Not lately. Not today.
Yeah.
So, but yeah, I mean, like, just kind of taking those little 5 minutes and not feeling as guilty like he told me, that's really helped kind of giving me a break, because I felt like I was underwater like all the time. It was like to the next, to the next, to the next.
And change happens slowly. We may come up with these big things. Okay, if this person does this and this person does this, but it happens slowly. But it happens. Look at the Grand Canyon. Have you been to the Grand Canyon?
Yeah.
It's huge. It's huge. You almost can't register it because it's huge. It's a big hole, and it started with a little stream, but it had millions of years. So a little change, and you build on that. So you made a nice little change, right? You spent some time for yourself. So, and that's working out. That's positive, even though you're tired.
Yeah, I think so. It's kind of helped me balance a little more.
Good.
And now I've kind of like come to enjoy knowing that at the end of the day, for just a few minutes, I can have, time to kind of digest what happened at work and then go home and be able to deal with the kids, like charge my batteries. So
Have you tried any of the delegation?
not yet. The kids are really kind of, I don't think I did it the right way. I just kind of was like, well, I need you to go do this. And they were like, why? Or they ran away. And then, then I was yelling and I just got frustrated. And so I just said, try again later.
How old are your kids?
9 and 11.
9 and 11. Okay. So they have very important things that they're working on. And they are used to mom doing everything else.
Yeah, and they're older siblings too, so they have 4 older siblings that did
Yeah.
everything. So nobody does anything. There's no accountability. And so they
Uh-huh.
fight and they melt down. And, the 11-year-old's a girl and she's kind of getting that preteen stage. So there's a lot of
Mhm.
attitude and, back talking, a lot of emotion. She'll cry if I'm stern with her. So it's hard for me to navigate that. And then my son just gets real mad and melts down. And, so they have their own ways of just kind of bursting out and having a hard time. So I think because I'm so tired from everything else, I don't want to fight. So then I just give in. And then I don't want to ask them to do anything because then they're
It's
stomping.
easier if you do it.
Yeah.
Easier if you do it, right?
Yes. And I think there just needs to be some positive reward instead of the negative. What I'm used to is just yelling. I think I need to have more, okay, if we do this, we're rewarded in a way.
That's a great idea. And if you can come up with a reward that you'll really like, that'll be rewarding yourself too. What are some things that your family really likes to do that are stress relieving for you?
Oh, they're stress relieving for me. For me, I never think about me. Um, Gosh, I don't really know because everything, even just taking them to Disney or something, is exhausting for me because I have to drive and pack the snacks and carry the bag and listen to them whine. And there's no way that I'm just able to just relax. I guess maybe seeing a movie.
Movie could be good. Now remember, rewards don't have to be the trip to Disney. A reward can be we're going to watch a movie together, we're going to go to the movies, we're going to go for a walk, something that they like to do. For your kids, reward can be we get to see mom relaxed and we don't have to yell, you know? Um, so you had success with a small step, your 5 minutes. Can you think of something that can be like a little 5 minute responsibility for the kids that would help you out? Because remember, you have 4 kids that you have successfully changed into adults who know how to do all these things for themselves. You're not still doing their laundry, are you?
No, not at all. I don't even pay any of their bills. They pay them all themselves.
Perfect.
My 2
So,
cell phones.
what's that?
Just up for 2 cell phones.
You get on a family plan. So, what is something that can help? Because part of your job as a mom is to prepare them to leave, right? And come back with grandkids so you can spoil the grandkids and then they can drive the parents crazy. What is something, a small thing that can help you, but also help them, give them responsibility? Because 9 and 11, they feel like they're more grown up. They're ready for responsibility. So, what's something that,
Oh, that's tough because it's like when I ask them to do something, it's always like they get mad. They don't want to help. They just want to play on their phones or play video games. So it's more of like a chore,
it is
and
a chore?
they don't enjoy any of that. So
Well, do
um,
you enjoy it?
no, not at all. But I know if I don't do it, nobody will.
So, part of being 9 and 11 and wanting to be mature, because an 11-year-old girl, there's nobody more mature than an 11-year-old.
Um,
How, you know, a couple things. One, you don't have to ask them, you can just tell them because you're
yeah,
still mom.
that's when we get in arguments.
Takes 2 to argue,
That's
right?
true. I
What
definitely.
would happen if you said, guys, we're going to have a change? You're old enough for this now. So, what's going to happen is after dinner, you two will be responsible for clearing the dishes, putting them in the dishwasher, clearing up. Shouldn't take you more than 5, 10 minutes. It's easy. I'm going to let you have that responsibility. And not only that, but if you do it well for a week, let's have a nice reward. We've all been working hard. We've been a little stressed. Let's take a time out. How about we go to the movies? So you're not saying, Would you do me a big favor?
Yeah, that never happens.
Would you mind doing this? Because when you ask a question, you get their answer, and
That's
it may not be the answer you want. So what would happen if you did that? What would happen if you said, this is your responsibility now because you're old enough and it's wonderful and this will save me time, and as your reward, once a week we will do this.
no, sure. I mean, they're used to being rewarded for nothing, so they're used to having things on the weekend. So I mean, but you're right. I mean, they do like to help too, and they like to feel big and grown. You know,
Yeah.
so I think that might be a good thing, especially if they know it's like a regular thing that would happen, and that they can hold me to it, so to speak.
Well, and they expect it
Yeah.
because if you're saying to them, okay, guys, Saturday you're going to clean out the garage,
Mm,
that may take them all day, and maybe they've made plans. And
that's
their plans may have been, I'm going to play video games all day, but it still messes up the plans.
right.
So instead of that, saying, this is what you can count on. This will be your job, and you're helping me, and things are going to go smoothly. And now it's your job.
Yeah, I mean that definitely makes a difference. I think about how you present it.
Now you still may get some negative feedback. They still may say, "Mom, that's your job."
I'm sure, or they'll just run away and not do it
Well, then
because there's
there's no
no
reward.
follow through either. I get so busy, then it's no one's really holding them accountable if they don't do it. So,
Well, I mean, there is that holding them accountable. And it could be, we're going to try it and let's see how it goes. And if they don't do it, then you'll say, no, I've thought about it and you really need to do this. You may need to show them how to do it the first time that they've not done it. And you may need to give them a little guidance. But it's kind of like anything else. If you don't teach them how to do it, you think, do you want to be doing this when they're 50?
yeah, right. I need them though. I need them to do it on their own. That's true.
And they're smart kids. So is that something you might want to try?
Yeah, I think that's a great plan for next week. Will we get to meet again next week to follow up?
I hope so. Are you going to come next week?
Absolutely. I really enjoyed talking to you.
Fantastic. I enjoy talking to you. You're doing such a great job. Please keep spending a little time to yourself. We're building, right?
Okay. Okay. I can do that.
Okay. Thanks. Have a good week.
Thank you. You too.
That was the least Rogerian thing I've ever done in my life. Carl Rogers is going,
I
ah.
I could never do it. I just think it's so difficult to sit there like, yeah, I can't.
So, your kids drive you crazy. Mm-hmm.
Mhm.
Mm-hmm. Mm-hmm. You are so tired, honey. Get some rest.
Well, I am. I'm pretty exhausted. So,
Oh, I'm so
thanks,
sorry.
Sally. Okay, so next week, Monday, 7:30.
Yeah,
Okay.
Monday.
Okay. Sounds
Monday? Yes, Monday.
Yep. Monday, 7:30. All right.
Okay, great. Oh, wait a minute. Wait a minute. Oh no, I can do it. I'll be at work, but I can do it at work.
You sure you want it a little later or?
No, I can do it at work. I can take a break then and do it. It'll
Okay.
it'll work out fine. I'm getting confused because I'm taking her to the airport and then I can't remember when I'm going to pick her up and then keep going. No, Monday works perfectly.
Okay, so if it doesn't work, we could have a backup plan. I'm not sure what I'm doing in Seattle or San Diego because I'll be with a group of people, and I
Okay.
know like one evening we have to do like the after evening refresher or something like a dinner thing, and I think there's a couple other meetings for work, but we could maybe set something up one of those nights, like Friday or Saturday or something evening if we need to.